Imagine opening your eyes in a limestone cave in Borneo 31,000 years ago. You're lying flat on a woven mat. Firelight flickers above you, crawling across the cave ceiling. People are gathered close.
Several pairs of hands are holding your left leg down, keeping it from moving. There's no anesthesia, no stainless steel, no operating room waiting beyond the fire.
Just a blade, a circle of frightened faces, and a decision that sounds almost impossible. Create one wound to save you from another. Wait, why would anyone even try this?
Why cut into a living body when blood loss, shock, or infection could turn an attempt at rescue into a death sentence? And yet, the child on that mat survived. The lower leg was removed. The wound healed. The patient lived for years afterward. This wasn't an accident. It was an operation. Somehow, a group of hunter-gatherers knew enough to make the cut, control the bleeding, and keep a helpless child alive through everything that came next. The first operating room may not have been built inside a temple or a palace. It may have been a cave. Now, humans aren't the only animals that do something about an injury. In 2022, researchers observing a Sumatran orangutan named Rackus watched him chew a medicinal vine, press the liquid onto an open wound on his cheek, and then cover that wound with the chewed plant material. Chimpanzees have been seen doing something strange too, placing insects onto wounds. Sometimes their own, sometimes the wounds of another chimp. So maybe surgery is just the next step. The same instinct, only with a sharper tool. Right. Not quite. Healing responds to damage that already exists. Surgery creates new damage on purpose. To operate, you have to decide which tissue should be removed. You have to predict what the cut will do before you make it. You have to avoid the structures that could kill the patient, control the bleeding, and then somehow keep that patient alive once the cutting is over. You have to hurt the body without destroying it. Open the person, yet preserve the person. Wait, this is no longer simple wound care. This is not treatment after injury. This is injury designed as treatment. Before there could ever be a surgeon, there first had to be a patient who was allowed to stay a patient. Picture life inside a small, mobile group. Food has to be found, then carried, then divided. Everyone who can walk, climb, hunt, gather, or watch for danger matters. An injured person can't chase prey. They can't scramble up rock when something is coming. They can't move quickly when the group has to leave. If survival were nothing more than a cold calculation, abandoning that person might look efficient. But ancient bodies tell a different story. Shanidar 1. A Neanderthal, found in what is now Iraq, lived to an unusually advanced adult age, despite severe injuries and impairments that likely affected his sight, hearing, arm, and movement. Researchers still debate exactly how much assistance he needed, but his survival points to something important. Disability did not automatically mean exclusion. Someone shared food with him. Someone slowed down. Someone stayed. And that is where the origin of surgery begins. Not with the blade, earlier than that. It begins when four abilities come together. A tool precise enough to control. A mind capable of linking cause with effect. A group willing to organize itself around an immobilized body. And a belief that someone's future life is worth spending today's food and energy to protect. Before humans learned how to operate, they learned not to abandon the injured. Care came first.
Now go back to Liang Tabo Cave in Borneo.
The individual archaeologist, called TB1, was buried there around 31,000 years ago. The lower portion of the left leg was gone. But the remaining bones didn't end in the jagged damage you would expect from an injury near the time of death. They ended in remodeled bone. Bone that had changed shape. Bone that had healed. The evidence suggests the limb was removed during childhood, and that the person survived for another 6 to 9 years afterward. 6 to 9 years. Let that sit for a moment. That could mean 6 rainy seasons. It could mean 9. Either way, it means thousands of mornings after the wound had closed, inside a landscape filled with steep limestone, predators, parasites, and tropical microbes. Because the cut itself was only the beginning, skin had to be opened, muscle had to be divided, blood vessels had to be dealt with before blood loss crossed the line from dangerous to fatal. Then the remaining limb had to survive contamination, shock, fever, hunger. So how did hunter-gatherers know where to cut? We don't know what instrument they used. We don't know the exact method. We don't know whether the person holding the blade had done anything like this before. But the healed bone tells us what did not happen. The patient did not bleed to death. The wound did not destroy the body during recovery, and the group did not leave the child behind. That last part may be the most extraordinary thing of all. Because once the blade had done its work, dependence began. Someone had to bring water. Someone had to bring food. Someone had to clean the injury, watch for infection, protect the patient, and move at a pace the injured child could survive. Then they had to do it again, and again, long after the terror of the operation had passed, not for an afternoon, for years. The operation may have taken hours. Survival required years. One pair of hands can make an incision. Only a community can create recovery. Now move forward to Mehrgarh, in what is now Pakistan, sometime between roughly 9,000 and 7,500 years ago. Stone dust clings to a craftsperson's fingers. A narrow drill shaft spins as a bowstring snaps back and forth. A tiny piece of flint bites into shell, bone, or colored stone, opening a clean hole for a bead. This is skilled work. Pressure matters. Angle matters. Speed matters. Then, at some point, somebody looks at that spinning drill and looks at a human molar. Imagine being the person asked to open your mouth. There's no electric motor humming beside you. No dental anesthetic. No bright lamp above your face. Only someone's grip against your jaw. The scrape of stone and the vibration of a flint drill pushing into your tooth. Why would anyone agree to that? Because tooth pain can make every meal feel like punishment. Because an infection inside a tooth can turn a cavity into something far more dangerous. Because once the pain becomes bad enough, an experimental tool can begin to look like hope. Archaeologists identified 11 drilled molar crowns belonging to 9 adults. Microscopic evidence suggests that the holes were made using small flint points and a technique closely related to bead drilling. Even more telling, some of the drilled surfaces show wear. Their owners didn't die immediately after the procedure. They went on using those teeth. They kept chewing. These weren't decorative holes added after death. Living mouths carried them.
Wait, the revolutionary object here wasn't the drill. The drill already existed. What changed was where humans were willing to use it. The tool crossed a boundary from ornament to anatomy.
From craft to care. From shaping stone to changing pain. A beadmaker understands pressure. A beadmaker understands rotation.
A beadmaker knows that the wrong angle can crack the material, while the right angle opens a controlled passage. But enamel is not turquoise. Once the material beneath your hands can flinch, bleed, and scream, technical skill is no longer enough. Now the operator has to read pain, earn trust, stop at the correct depth, and accept responsibility for whatever happens when the tool comes out.
That may be one of the strangest things humans do.
We take a solution built for one problem, carry it somewhere it was never meant to go, and see whether it can solve another. Same motion, different purpose. Same tool, different moral weight. Human medicine began when a tool crossed from craft into flesh. If you're still with me, hit subscribe because the next surgeon did something even stranger. He turned a missing face into a repairable design. Now travel to northern India and to the surgical tradition associated with the Sushruta Samhita, whose early foundations are often placed in the first millennium BCE. Here, surgery begins changing into something larger than a single act performed by one unusually gifted person. A student can practice before touching a patient. Incisions are rehearsed on gourds and cucumbers. Punctures are practiced on leather bags or animal bladders filled with fluid. Suturing is learned on materials that imitate the pull and resistance of skin. In other words, the learner approaches the body through simulation before a blade ever reaches living flesh. Then comes one of the most striking procedures described in that tradition, rebuilding a damaged nose. A leaf is used as a template for the missing shape. Skin from the cheek is measured, cut, and moved into position, while part of it remains attached so the tissue can keep receiving blood. The flap is then placed over the missing area and secured. Think about the mental leap hidden inside that procedure. You have to look at an absence and see geometry. You have to look at skin and see material that can be moved. You have to understand that living tissue might survive in a new position as long as its connection to blood remains intact. Not replacing the face, persuading the body to rebuild it. But the deepest breakthrough isn't the skin flap itself. It's the lesson built around it. The procedure can be broken into steps. Those steps can be described. The movements can be practiced by someone who never met the first patient and then taught again to another person who hasn't even been born yet. One mind discovers something. Another records it. A third changes it, sharpens it, improves it. Surgery became human when skill became instruction. By this point, surgery can feel like something only humans could have invented. Then the ants show up. In 2024, researchers studying Florida carpenter ants, Camponotus floridanus, reported something that sounds almost absurd until you see the logic behind it. When one ant suffered an injury high on the leg near the femur, its nestmates did not just clean the wound and move on. They gripped the injured limb, worked their jaws around the joint, and slowly bit the leg away. An amputation. and it improved the injured ant's chances of survival. But when the wound appeared lower down, near the tibia, the response changed. The ants did not amputate. They focused instead on cleaning the injury. So this was not blind biting. The treatment depended on where the damage was. Wait, does that make ants surgeons? Because if an ant can remove a limb to save another ant, then cutting to preserve life is not exclusively human. For a moment, the entire idea seems to fall apart. The easy move would be to search for some physical feature that keeps humans safely on top. Our hands, perhaps. Our tools. Our ability to make the cut. Except that answer no longer works. Ants can amputate. Primates can apply medicinal substances. Social animals can clean injuries, protect wounded companions, and reduce the risk of infection. So the difference is not the hand. It is not the blade. It is not even the incision. The human breakthrough begins before the cut is made and keeps moving long after the original patient is gone. Imagine a body that does not exist yet. A body after the infected limb has been removed. A body after the painful tooth has been drilled. A face after missing tissue has been rebuilt. Humans can hold that future body in the mind while looking at the suffering body in front of them. Then they can compare possibilities, cut here or there, remove this or preserve it, act now or wait. We are not simply responding to damage. We are choosing between imagined futures. And then we do something even stranger. We explain what we did. We give the instruments names. We divide the operation into steps. We practice on gourds, leather, models, and bodies donated to science. When something fails, we study the failure, change the method, and teach the correction to people we may never meet. An ant colony can preserve a useful behavior through instinct and social signals. Humans can carry an idea beyond the colony, beyond the family, and beyond the lifespan of the person who first discovered it. A surgeon can learn from a teacher who died centuries ago. A patient can survive because someone, somewhere, made a mistake and recorded it. That is the deeper divide. Healing can evolve. Knowledge can accumulate. The human breakthrough was not the incision. It was cumulative medicine. And this story is not sealed inside an ancient cave, buried with a skeleton, or locked inside an old medical text. It is inside your body. Maybe you have had a tooth pulled. Maybe someone stitched a wound closed after an accident. Maybe a surgeon removed your appendix before it ruptured. Maybe you entered the world through an incision that saved your life, your mother's life, or both. Look at your scar, if you have one. That thin line is more than damaged skin that healed. It is the newest link in a chain of decisions stretching back tens of thousands of years. The people holding the child still in Borneo never knew your name. The craftsperson drilling into a molar at Mergar could not have imagined your dentist's electric drill, the reclining chair, or the numbness spreading through your jaw. The student practicing incisions on a gourd in ancient India never saw a sterile glove, a heart monitor, or an operating room flooded with white light. But each of them left something behind, a movement that worked, a failure worth remembering. A method another person could repeat. Then the next generation added something else. Cleaner instruments, safer anesthesia,
A sharper understanding of anatomy. Better control of bleeding. Better ways to prevent infection. One improvement at a time. Your body may have survived because people who never met you refused to let useful knowledge disappear when they died. That is what medicine gives you. Not just treatment. Inheritance. Every scar on your body is tied to knowledge older than civilization. You carry that history under your skin. Now return to the woven mat inside the cave in Borneo. The fire is still moving across the limestone ceiling. The child is still lying there. The blade is still close. But it no longer feels like the center of the story. The hands do. The hands holding the leg still. The hands bringing food and water. The hands cleaning the wound, changing its covering, lifting the patient, and protecting a body that could not run for years afterward. Imagine the decision buried inside that moment. Cause pain now to prevent worse pain later. Remove part of the body to save the life inside it. Wound the present because you can picture a future that has not arrived. Across millions of species, animals avoid pain. They endure it. They escape it. Humans learn to plan through it, not because we defeated suffering, because we could imagine something on the other side. A healed body. A life continued. A person who was still worth feeding tomorrow. From that cave, knowledge kept moving, from hands to voices, from villages to manuscripts. From practice gourds to lecture halls. From firelight trembling on stone to operating rooms bright enough to erase every shadow. Wait, the greatest invention was never the blade. It was the future inside the healer's mind. 31,000 years later. That imagined future may include you. Ancient surgery was not proof that humans had conquered pain. It was proof that we could see beyond it. We learned to cut without killing and then taught the future. Subscribe.